Hi, health law classmates. My name is Andrea Velarde, and I am here to give my debate. I am pro physician-assisted suicides in the United States. So this has been a discussion in the making since about at least 1993. So before we get started in that, we should know the difference between physician-assisted suicides and euthanasia. With euthanasia, the doctor or the physician prescribes you a certain lethal dosage of something and is the one to administer it. With physician-assisted suicide, the physician prescribes it to you and you, the patient, take it yourself. Sorry, this is my dog crying. So that's the main difference. It's the biggest difference, and it's the key difference is how the lethal dose is administered to the patient. Whether with euthanasia the physician does it or with physician-assisted suicide, you, the patient, do it yourself. So back in 1993 was basically when the Deaths with Dignity Act became real. So basically what this means is that a bunch of people had come together and said, look, they want to die peacefully, these patients, whether they have some sort of terminal disease, illness, whatever it may be. And so the Deaths with Dignity was passed in 1993, and since then we now have about 9 states and 1 territory in the United States where it is legal to have a physician-assisted suicide. Aside from all of this, the reason why I am very pro on this, and I do feel very strongly about it, is because most patients who opt into physician-assisted suicides are in a lot of pain, they are suffering, and they just want to end their life as peacefully and as painlessly as possible. This is that perfect way for them. So if they were to continue on life support as a vegetable for months on end, the bills would rack up and the pain and the suffering would just be endless forever. It would feel like forever at least, and the poor family has to go through that as well. It's the emotional toll, it's also the financial toll, not only on the patient, but more importantly the family, because once the patient does pass, that financial burden is then left on the family to figure out and pay for it themselves. Having this way to opt into having the physician-assisted suicide means you might not be in the hospital as long because you know when you want to do that. In Switzerland, they are a whole lot more lenient on this ideology and school of thought, and their only restriction mainly is that you do not have any bad intentions with, of course, the physician-assisted suicide, which can be difficult sometimes to prove, but most of the time when someone has a chronic disease or is just in so much pain and suffering, it's pretty obvious their intentions. A lot of people will argue that, when doctors took their Hippocratic oath, it said that I will do no harm. It says that I will never administer a lethal dose to a patient, which is understandable, but this oath was written ages ago. Times have changed, people have changed, circumstances have changed, and although there are very few things that still apply to the day and age that we live in today, this isn't one of them. Frida, it's okay. And so even though it is going against the Hippocratic Oath, there could even be a day that we sit down and reassess the Hippocratic Oath and say, okay, these are the circumstances that we're now seeing our patients in, and I would rather see them in less pain than have them endure pain for a lot longer. Overall, I'm very pro physician-assisted suicide for the financial gain, the emotional stability, a little bit more stability for the family as well as the patients, and just the overall well-being for the whole family, because it's very difficult to see someone that you love suffer and struggle for a long period of time. So thank you guys.